नमस्कार. प्रुडंट मिडियाच्या हॅलो दोतर कार्यावळीत तुमकां सगळ्यांक मना काळजान सावन उपकार. आज आमचे बरोबर असे गोंया भायले आनी तज्ञ असे जाणकार आमचे बरोबर आसात आनी तांकां येवकार दितना आमकां खूब खोस जाता. मुद्दाम बेंगलोरच्यान आयिल्ले डॉक्टर श्रीधर P.S, कन्सल्टंट आनी हे डायरेक्टर आसा सायबर नायफ, त्याच बरोबर कन्सल्टंट सिनियर कन्सल्टंट जावन आसा रेडिएशन ऑन्कॉलॉजीचे आनी एक ह्या फिल्डांतलो म्हणजे कॅन्सर फिल्डांतलो एक तज्ञ असो मनीस आज आमचे बरोबर मुद्दाम मुजरत बेंगलोरच्यान आयला. ताच्या खातीर आमकां खूब खोस दिसता की ह्या कार्यावळीची आमची म्हणजे तितको एक पॉप्युलरिटी आसा आनी तुमचो सगळ्यांचो आमचेर आशिल्लो विश्वास की ह्या कार्यावळीच्या माध्यमांतल्यान तुमचे कडेन तरेकवार विशयांची वैजकी माहिती आमकां पावोवचो एक प्रयत्न आसतात आनी ह्याच प्रयत्नाची मोख ही पुराय करतना आज आमचे आसा डॉक्टर श्रीधर. डॉक्टर नमस्कार, वेलकम.
नमस्ते.
पयलीं सांगता की डॉक्टर इंग्लीश आनी हिंदीन उलयतले, पण हांव मदीं आसतलो त्या खातीर थोडेशे जे कितें अणकारूं शकता ते हांव कोंकणीन सांगपाचो प्रयत्न करतलो. तर हो जो आमी म्हयनो मनयतात ताचो एक स्पेशली एक सिग्निफिकन्स आसा की दीस इज वर्ल्ड कॅन्सर अवेरनेस मंथ, किंवा ह्या दिसांनी ह्या म्हयन्यान एक कॅन्सर अवेरनेस डे बी म्हणजे दिसय आसता. So let's go first of all, Doctor, what you mean by Cancer Awareness Month or Cancer Awareness Day?
February is the World Cancer Month. Actually, February 4th is celebrated as World Cancer Day. Awareness program क्या हो सकता है कैंसर के बारे में, ये सब की बताना ज़रूरी पड़ता है. So that's why every year we celebrate World 4th February as a World Cancer Day.
So basically cancer awareness म्हणजे लोकांमध्ये कॅन्सर ह्या रोगाविषयी जाणवी काय जावची, ताची तरेकवार माहिती उपलब्ध जावची. म्हणजे लोकांनी कॅन्सर हे शब्द आयकतकूच पयलींच्या भशेन गर्भकळीत जावपाची गरज ना. आता जे नवे तंत्रगिन्यान आसा तातूंत निदान बेगीन जावं शकता, ताची ट्रिटमेंट म्हणजे मॅनेजमेंट बरे तरेन जावं शकता. हाचे विशीं लोकांक माहिती दिवची, एक जागृती करची, ही मोख लक्षांत दवरून हो कॅन्सर अवेरनेस मंथ किंवा कॅन्सर अवेरनेस डे 4 फेब्रुवारी म्हणून मनयतात जगभर. डॉक्टर, वेन वी टॉक अबाउट दिस अवेरनेस, देर इज ऑल्सो एवरी इयर दे कम विथ अ न्यू थीम. सो वॉट इज द थीम ऑफ दीस इयर? म्हणजे दर वर्सा एक त्यांचे एक घोषवाक्य असतात दर वर्सा खातीर. सो आम्ही दोतोराक विचारतो की ह्या अनुचे घोषवाक्य कितें आसा? वॉट इज द थीम ऑफ दिस इयर?
So this year World Cancer Day theme is actually close the care gap. So close the care gap means actually कैंसर में बहुत ज़्यादा गैप्स है. लाइक इट मे बी स्टार्टिंग फ्रॉम डायग्नोसिस, accessibility and affordability, और then actually once they are diagnosed क्या क्या treatment हो सकता है. So and afterwards not only with the caregivers, patient, relatives, economically the challenge, medicines available नहीं हो सकता है. ये सब and identifying and in an higher this one you need to identify across the country or the world in a politically wise, so that like we can give a proper services.
Absolutely.
So identify the problems and then we need to make sure that have a solution. So iska liye 22, 23, 24 is all 3 years we have put it as a cancer close the care gap.
अच्छा. सो डॉक्टर म्हणजे कॅन्सर म्हणजे क्लोज द कॅन्सर गॅप, करेक्ट?
Close the care gap in the cancer.
सो हाचे मोख अशें आसा की लोकां मदीं जागृतकाय जावची, तांकां एक अवेरनेस येवची. एट द सेम टायम सी इट इज नॉट जस्ट एक अवेरनेस आयले ते जागृत आसा, पण तांकां अफोर्डेबिलिटी जावची. एक तरेकवार जी आज उपलब्ध वखदां आसात किंवा जी माखनां आसात तांच्या विशीं तांकां एक तेंचे इट शूड कम विदन रीच ऑफ द पेशंट अँड दे शूड बी इट शूड बी अफोर्डिंग. सो हें करतना सबंद देशाचो विचार करून, इट इज नॉट ओन्ली बाबा हा अफ्लुएंट क्लास आसा तांकांच हें शक्य जातलें, बाकीचो गरीब आसा ताका जावचें ना, अशें जायनासतना सगळ्या लोकांक हाची चडांत चड माहिती आणि जे तंत्रगिन्यान उपलब्ध आसा ताका बरो करपा खातीर, ताका उपाय दिवपा खातीर तें उपलब्ध जावचें, ही एक व्यापक मोख आसता. Doctor, when we are talking about this awareness or the theme, what is your because what I meant to say that just now you mentioned about mostly when we talk about cancer is breast is one organ which is mostly the same. Why is it so, and what is the significance or what is the incidence in general? I'm not talking about figures.
So if you see world cancer throughout the world, if you see male and female, if you take the first 5 cancers, top 5 cancers, top 5 cancers में in female definitely breast is the number 1 across the world.
Achha.
And same in India also. So in India the cervical cancer was first, but now the breast cancer is we see number 1 even in India. And like other cancers is adrenal cancers, lung cancer, and stomach cancers. These are some of the top 5 cancers or endometrial cancers in female. In case of lung, tobacco related cancers are one of the things. Smoking, definitely head and neck cancers, lung cancer, prostate cancers comes in the top 5 now, and hepatobiliary is also coming in the top 5. So overall, if you say the incidence of cancer in female, the breast cancer is one of the things which is challenging to treat and is causing the problem across the world.
सो ह्या गजालींतल्यान आमकां दोतोरान एक म्हत्वाचो मेसेज सांगला की कॅन्सर हो बायलांचो जो स्तनाचो कॅन्सर आसा तो कॉमन आसा जगभर. बाकीचे कॅन्सर आसा म्हणजे सर्वायकल कॅन्सर आसा, हिपेटोब्रम म्हणजे फिगदाक जावपी कॅन्सर आसात, प्रोस्टेटाचो कॅन्सर आसा, तोंडाक जावपी जे तंबाखू गुटखा खातात तांकां जावं शकता, किंवा जे स्मोकिंग करतात, सिगरेट विडी ओडटात तांकां लंग कॅन्सर जावं शकता. अशे तरेकवार कॅन्सरांचे प्रिवेलन्स भारतांत तरी भरपूर आसा आणि हे बरेचशे आमी आळू शकता म्हणजे आडावं शकता. आणि त्या खातीर ही जागृतकाय हें अवेरनेस हें खूब म्हत्वाचें आसता की लोकांक जेन्ना हाची जाणविकाय येतली तेन्नाच हाचेर कितें तरी सोल्युशन जावं शकतलें. अँड दॅट इज अ रायट वे ऑफ अप्रोच टुवर्ड्स दीस प्रॉब्लेम विच इज अ ग्लोबल पॅन्डेमीक आय कॅन से एट दीस मोमेंट. बरोबर डॉक्टर, वन मोर थिंग आय एम जस्ट आस्किंग एज अ यू कॅन से दिस इज अ लिटल अकॅडमिक. They are saying now cancer is also a lifestyle disease nowadays. So what is your take on this? And after this you can talk about and tell us about the etiology of cancer. I'm putting both these questions together to you.
Yeah, so lifestyle definitely is one of the risk factor for any cancer. Lifestyle changes what we have done. So we are more into sedentary life, so less of activities, and whatever we eat. So the obesity is one of the things what we are looking as risk factor for cancers. So majority of any cancers, lifestyles are the major things what we put it as a etiology. Another one is the genetic makeup.
Achha.
So genetic makeup in the past, actually when you are in medical college and all, when we say what is the etiology of cancers, to answer your question, first sentence we say that exactly cancer क्यों आता है पता नहीं किसी को. So we don't know the exact etiology.
Correct.
So we blame it on one. We see it's the lifestyle changes. Another thing what we see is genetic makeup. So the genetic factors, we can check it out that genetic factors are the one which is germline and somatic mutations, what we call it as, is one of the main causes of cancers. So that is becoming 30 to 40% now.
Achha.
So identifying those things are very, very important. So those are the two factors what we say is the etiology of cancer. If you come to the breast cancer, see now in the past we always told that breast cancer is in the postmenopausal woman. 55, 60 years, breast cancer is common, usually hormone related, estrogen and progesterone dependent. But nowadays, even in India, we have seen younger age group getting breast cancer. As early as in the clinic, they can like 15 to 18 years. 18 years females also have the breast cancers. Anything less than 40 years when the patient gets a breast cancer, we always think that we need to get a proper genetic counseling and genetic testing done for that patients. उसमें बहुत ज़्यादा information मिलता है. इसके वजह से one of the example is a triple negative breast cancer. So उसमें उसके हिसाब से treatment is different. Aggressive treatment is required, and they are aggressive in nature whenever there is a young age group.
ओके, आय जस्ट सेड दिस थिंग. सो दोतोर एक म्हत्वाचो आमकां ताणें सांगला की हे फक्त कॅन्सरचें निदान जालें म्हणून जायना, तर ताचें जेनेटिक प्रिडिस्पोजिशन किंवा जेनेटिक कंपोजिशन जेन्ना आमकां कळटा किंवा आमी स्टडी करता तेन्ना हाची ट्रिटमेंट लायन चेंज जाता. म्हणजे हाचो उपाय जो आसा ताची टोटल लायन ऑफ ट्रिटमेंट चेंजीस, हाका एग्रेसीव लायन ऑफ ट्रिटमेंट लागता. आनी दोतोरान म्हत्वाची गोश्ट सांगली की आतां चडशा फावटी आमकां दिसतालें की जाणटेपणा म्हणजे आफ्टर पाळी बंद जाल्या उपरांत बायलांक ब्रेस्ट कॅन्सर जाता असो. पण डॉक्टरांचें अशें मत आसा की तांच्या क्लिनिकान तांच्या हॉस्पिटलांनी पळयलां की इवन यंगर जनरेशन जे आसा म्हणजे 18 to 25 ह्या सुद्दां यंग चलयांक किंवा बायलांक म्हणजे तरण्या वयार सुद्दां कॅन्सर जावं शकता. आणि हाची मॉडॅरिटी ऑफ मॅनेजमेंट इज डिफरंट फ्रॉम हाव यू मॅनेज अदर एल्डरली एज ग्रुप. करेक्ट डॉक्टर? सो वेन वी आर टॉकिंग अबाउट दिस ऑल दिस, देर इज ऑल्सो अनदर मीन्स पीपल फर्स्ट ऑफ दे आर स्कॅर्ड नाव. Not only now, earlier also. The word cancer itself is a very scary, whether you are even in the medical profession also, because unfortunately sometimes, see, we are also human beings. But that word is now gradually, see, in fact, I feel that you have got a very, your tagline of your hospital is very, I think, live with...
adding life to cancer.
Adding life to cancer. So, हो जो महत्वाचो मुद्दो आसा की adding life to cancer, म्हणजे कॅन्सर जाल्या उपरांत खंयच्याय मनशान, whether male, female, whatever it may be, तर गर्भगळीत जायनासतना हाका कशा तरेन आमी फेस करूं शकता, हें आव्हान आमी कशा तरेन पेलूं शकता. आनी हें सगळें करतना फक्त वखदां न्हय, ताका एक फॅमिली सपोर्ट लागता, त्या मनशाचो एक मेंटल प्रिपरेशन लागता. हें सगळें तयार करप, एक ताका सोशली ताका एक सपोर्टीव लायन ट्रिटमेंट तयार करप, This all thing comes into picture. Doctor, when we talk about breast cancer, now definitely the signs and symptoms. So what are the signs and symptoms of this?
See, most of the times the breast cancer symptoms are painless lump in the breast. So painless lump in the breast in anybody, you should not be neglected.
Correct.
So that is most of the females actually, oh, this is especially fibroadenoma is one of the things they say that, okay, they gone to the doctor, they say not to worry, so ye hota hai. So any lump in the breast should be evaluated unless otherwise proven. So वो cancer नहीं है करके prove करना important है. So whenever there is a, and other than that sometimes small lump रह सकता है, उसके वजह से if it is spread to the other places, a lump in the axilla, and it may be a bone pain, or it may be loss of appetite, loss of weight. Sometimes if it is goes to the lung, you will have a breathlessness, and if it goes to the brain, seizures. So these are all called advanced stages of breast
or
cancer.
when it is spreading.
Spread.
So doctor, just for the inference of our people, डॉक्टरांनी सांगला की आणि हांव सदांच दर फावटी एक महत्वाची गोष्ट सांगता ते म्हणजे एनीथिंग विच इज पेनलेस इज मोर डेंजरस. आणि अनफॉर्च्युनेटली जो ल्हानसो गुळो किंवा गाठ आमकां लागता म्हणजे बायल मनशांक लागता स्तनान किंवा ब्रेस्टान, ती ते इग्नोर कित्या खातीर करता कारण ती दुखना. So basic problem, it doesn't pain. And in fact, I always conclude, I say that whatever is painless is more dangerous.
Correct.
Comparatively. Like
Yes.
see if you get a boil or abscess or if you get tooth pain. Person however rich, poor, he will go to some doctor or other or he will take some remedy. Whereas same thing with CA cervix or cancer of the breast. Since it is painless, they ignore it. No, and then they try to know, एक बार छोटे बच्चे ने bite किया था, मार लगा था, I had fallen in the jungle. They have their own stories to correlate, and they don't go to doctor. That is another unfortunate event.
Yes.
And whereas हेतून एक खूप महत्व आमी दर फावटी ह्याच खातीर सांगता की त्या वेळार डॉक्टराकडे वचप खूप गरजेचें आसता रादर दॅन जस्ट इग्नोरिंग इट. आनी तुमचे भितर तर्क बुद्धी लडोवन तें कितें जालां आसतलें, आपूण तेन्ना पडला आसतलें, ते बाकाचो कोणचो लागलेलो, मेज आपटलेलें, हें अशा तरे सी इट मे ऑर मे नॉट बी. सेकंड थिंग, वी आर नॉट सेईंग एवरी लंप इज अ कॅन्सर. डॉक्टर आतां सांगलां तें म्हत्वाचो वाक्य आसा की फायब्रोएडेनोमा आसता तो केन्ना केन्ना जावं शकता तशें, पण तुम्ही डॉक्टरा कडेन वचून प्रॉपर इव्हॅल्युएशन करप खूप गरजेचें. सो द पर्सन हॅज टू गो टू डॉक्टर अँड गेट इट प्रॉपरली इव्हॅल्युएटेड रादर दॅन जम्पिंग इट्स ओन कोरेटिंग द फॅक्ट नो वन्स आय वॉज वेन इन चाइल्डहूड आय हॅड फॉलन ऑर दिस थिंग वॉट एव्हर. सो दॅट शूड नॉट हॅपन. दिस व्हेरी इम्पॉर्टंट. म्हणजे ह्या कॅन्सर अवेअरनेस मंथाचो किंवा दिसाचो जर मेन ऑब्जेक्टिव्ह आसा तो हेच की लोकां मदीं एक जाणविकाय निर्माण करची की बाबा दिस इज अ टायम यू हॅव टू गो टू डॉक्टर. Even however small or big it may be. So the moment you realize there is something somewhere, तुम्हाला फील जालो, कारण हे बायल म्हणजे स्वताकच फील जावं शकता बिकॉज वेन शी इज वेअरिंग हर ड्रेस फॉर वॉट एवर इट इज ऑर वेन हॅविंग बाथ आफ्टर पिरियड. देर ऑल्सो अदर डॉक्टर म्हाका सांगतले की how to just in short you can tell us about this breast self examination.
Yes,
in short.
yes. So breast, the how to identify.
Yeah.
You told very
Correct.
clearly that ignorance is one of the things. Everybody make it like that. Or lesion was there, but we neglected.
Correct.
So you should never neglect. So how to identify the cancer awareness month? That is another thing we always do it. So educate the people.
Correct.
The people who don't have the cancer or the people who are associated with these patients. So early, especially in school and all, we should say, but breast self-examination is the best.
Absolutely.
Breast self-examination is a very simple procedure. You have to examine your breast in a circular manner. There are a lot of things available on the net.
Correct.
To
Absolutely.
identify it as early as, like I'll tell you, 14 to 15 years, like the people should examine.
Correct.
And also, as you rightly said, painless. Don't wait till it becomes painful. So why we are so much worried about these things that you have to go early? Because if you identify this breast cancer in early, actually we are looking for a curative cancer.
Absolutely. Absolutely.
So we are looking that you can lead if you take proper treatment, you can lead a normal life for future.
Absolutely.
Whatever 20, 30 years of your normal life, what it is.
Absolutely. डॉक्टरांनी एक महत्त्वाचा मुद्दो सांगला की जेन्ना तुम्ही त्याचे निदान बेगीन करतात म्हणजे अर्ली स्टेजीन करतात आणि ट्रीटमेंट बेगीन सुरू करता यू कॅन लिव्ह अ फुल नॉर्मल लाईफ. म्हणजे तुम्ही आयुष्याची जसे तुमचे एक इव्हॅल्युएटेड बाबा हो म्हणजे 70 वर्सां 60 वर्सां जगतलो तितकी वर्सां तुम्ही आयुष्य नॉर्मल जगू शकता विथ द अर्ली इंटरव्हेन्शन. आणि हे खूप महत्त्वाचें आसता. सो जस्ट बिकॉज इट इज पेनलेस, ते दुखना पण खबर आसा आपल्याक आसा जाला खूप दिसतले ना ताका 5-6 महिने अशें म्हणून रावू नाकात. The moment, and fortunately now, see a place like Goa, we have got a lot of healthcare facilities. private sector people are there, we have got government hospitals, and we do all including FNAC, mammography, all this facility available free of cost. आणि हाचो सगळ्या लोकांनी फायदो घेवचो. सो तुमकां जेन्ना अशें केन्नाय दिसून येता, you can come directly to Goa Medical College, you can go to district hospital, we have got South Goa District Hospital, North Goa, and a lot of good facilities are available in state like Goa. So it is not that you have to go some far off place like Mumbai or Bangalore. So these are basic things. आणि डॉक्टरान एक गोष्ट महत्वाची सांगल्या, ती हांव ह्याच खातीर रिपीट करता की ही सगळ्यांक कळप खूप गरजेचें. वन्स अ गर्ल म्हणजे खंयचेच बायल मनशेक जेन्ना आपले पिरियड येवपाक सुरू जाला तेन्ना आनी जेची आपले शारिरीक ग्रोथ जाता तेन्ना तिने एक संवय लावन घेवची, स्वताक सेल्फ एक्झामिनेशन करपाचें. हाव द सी नॅचरली अ लेडी बिफोर वेन गोईंग आउट शी लुक इन टू द मिरर, एडजस्ट हर लिपस्टिक, आयब्रोज, वॉट एवर इट इज. सो इन द सेम वे वेन यू आर मे बी ड्युरिंग बाथ ऑर आफ्टर दॅट एक मी संवय लावन घेवपाक जाय आपल्याक स्वताक सेल्फ एक्झामिनेशन करपाचें. स्पेशली आय एम नॉट सेइंग एवरी डे, मे बी आफ्टर पिरियड, बाबा पिरियड जाला पण एक स्वताक बाबा ड्युरिंग पिरियड, आफ्टर पिरियड एक स्वताक हात लावन स्वता एक त्या मनान दवरून तपासपाचें. जस्ट फॉर द सेक ऑफ डुईंग इट, डोंट डू इट, कीप इन मायंड. आणि हाचेर कितलेशेच लिटरेचर अवेलेबल आसा, तुम्ही डॉक्टरचो सल्लो, बिकॉज यू युअर सेल्फ इज द फर्स्ट पर्सन टू आयडेंटिफाय दॅट.
एब्सोल्युटली, युअर बॉडी टेल्स.
युअर बॉडी टेल्स. सो हो महत्वाचो मुद्दो आसा आणि म्हाका दिसता हो सगळ्यांनी मतीन घेवन खूप गरजेचें आसा. जशें तुमी तुमचे कपडे, तुमचे बाकीचे सगळे बाकीचे जे कितें कॉस्मेटिक्स तेचेर तुमी लक्ष दिसता, तशेंच प्रमाणे तितकेंच महत्वाचें हाचेर लक्ष दिवप. एम आय रायट, डॉक्टर?
Absolutely.
So now, doctor, once we have identified the problem, patient has come. Now, what are your lines of investigation and how you come to conclusion? That is necessary.
So most of the times there is, when they identify a breast lump, don't get scared. I know that one report changes the whole life.
Correct.
So actually proper investigations is important. There is no emergency in breast cancer.
Absolutely.
So you need to identify. एक biopsy करते हैं, biopsy के बाद we do a battery of test. Biopsy is very essential. उसके बाद like immunohistochemistry.
Correct.
And if it is required, I'll suggest genomic testing. If it is available, it should be done upfront. So that will definitely give. Then we do a proper investigation. The best is the whole body PET CT scan. Whole body PET CT scan will correctly stage. Once we identify you have a cancer, and then we need to stage correctly. That is called whole body PET CT scan. उसमें पता चलता है it is localized or gone into a different level. Okay. So in our hospital, like once this is done, each patient is discussed in something called multidisciplinary team.
Absolutely.
MDT, like multidisciplinary, where surgeons, medical oncologists, radiation, psycho-oncologists, radiologists, pathologists, all of them are together.
Sitting across the table
and
discuss.
We'll make a plan for this particular patient and say that this is how we want to do it. So that is essential. So all the things in under one roof makes a lot of difference. Then if it is an early cancer, then in case of breast cancer, surgery, chemotherapy, radiation, hormones as and when required, or immunotherapy, all these things are an essential part of the treatment.
Achha.
In an ideal situation, all these things will take around 4 to 6 months.
Achha. Now everybody is eager, definitely. When we talk about the management of cancer, maybe breast cancer, since we are talking more about the breast cancer, the line of treatment 10 or 20 years back and line of treatment today is totally different.
Absolutely.
Line of management and how it is tackled is totally different. So I will be very happy if you can tell us about what is the present situation and how we are heading, or how we can still fight this battle and win over it. That's more important.
Correct. So identifying the breast cancer, which type, is very essential. We consider triple negative breast cancer versus non-triple negative breast cancer, because triple negative breast cancer is a little bit aggressive. Chemotherapy is an integral part. So, and surgery is an integral part, and radiation is an integral part.
Correct.
Breast conservation surgery, breast conservation treatment is the essence of any breast cancer, because there is no need to remove the whole breast at nowadays, because it does not give any extra benefit of not giving. So in surgery, we do breast conservation surgery. Afterwards, like we give chemotherapy, and sometimes we give chemotherapy before only 4 to 6 cycles, or it may be 8 cycles, reduce the tumor, because we are, the moment if it is more than 5 millimeters, it is systemic in nature.
Achha.
So local treatment and systemic treatment both are important. Fear about chemotherapy is that hair loss and loss of weight, all those things, it is all temporary.
Achha.
But it's for a good cause. Actually, you should take a proper treatment, and you should talk to the doctor and modify the dose if it is required. The moment if you do a breast conservation surgery, the radiation is important. Radiation is done as a whole breast radiation and a local on a linear accelerator based or a localized treatment.
Correct.
Where when these three things are complete, then only we can consider it as a complete cancer treatment for breast cancer.
Acha.
Depending on the hormone status, we also give treatment for the hormones for 2 to 5 years. Sometimes we do, follow-ups are very important in breast cancers. 4 to 6 months, at least a PET CT scan will give an exact idea that what is any metastasis or anyone. Even if it is a metastatic one, now there is a very effective treatment is available. Two things are important: genomics for these patients, genomic guided targeted agents are there, and immunotherapy. This is another medical management where we can give immunotherapy and make sure that your immune systems works against the cancer. Even in metastatic, we use a targeted radiation which is called stereotactic body radiotherapy with CyberKnife, and where we thought in the past like the treatment is not possible and the patient is going to be sided like nothing can be done, we have seen double digit of survival.
Okay, so now I'm very happy. Before we conclude this program, let me tell very important factor. Since doctor has already mentioned a lot of investigations, a lot of high-tech equipments and gadgets in management of cancer. एक महत्त्वाची गोष्ट सांगू सोदता की डॉक्टर ज्या सेंटरासून आयल्यात म्हणजे HCGचे हे हॉस्पिटल गोवा गव्हर्मेंटच्या DDSY स्किमीच्या अंडर एम्पॅनल्ड आसा. सो वॉट एवर बेनिफिट्स अवेलेबल फॉर द सिटीजन्स ऑफ गोवा, गोंयान रावपी खंयच्या मनशा खातीर जाका DDSY कार्ड आसा तो ह्या हॉस्पिटलाची बेनिफीट किंवा जे ट्रिटमेंटाचे मॉडेलिटी आसा ते गव्हर्मेंटच्या स्किमीच्या अंडर घेवंक शकता. ही खूब बरी गजाल. आणि ह्या पद्धतीची जी ॲडव्हान्स मॅनेजमेंट सिस्टम आसा ताचो फायदो घेवंक शकता. इनफॅक्ट वी शूड ऑल बी थँकफूल टू गोवा गव्हर्मेंट, डायरेक्टर ऑफ हेल्थ सर्विसीस एंड अवर हेल्थ मिनिस्टर एज वेल एज चीफ मिनिस्टर फॉर प्रोवायडिंग दिस फेसिलिटी टू द स्टेट ऑफ गोवा एंड द सिटीजन्स ऑफ गोवा. सो हें सगळें करतना आमी देवा कडेन मागता की कॅन्सर कोणाक जावं नये, पण समजा जालो जाल्यार ताका गर्भकळीत जायनासतना भिनासतना टक्कर दिवपाची आजची जी सगळी साधन सामुग्रीन सगळें जे वैद्यकीय ज्ञान उपलब्ध आसता ताका हँड इन हँड घालून एकमेकान वी कॅन ऑल विन द बॅटल. ही आयची कार्यावळ सोंपयतना तुमकां सगळ्यांक काळजांतसान देव बरें करूं. डॉक्टर, थँक यू फॉर स्पेरिंग युअर प्रेशियस टायम. यू हॅव कम ऑल द वे फ्रॉम Bangalore to deliver this program. I'm really grateful to you on behalf of our Prudent Hello Doctor team as well as our viewers. Thank you very much.
Thank you.
So nice.
Thank you.